All right, so Dory, Claude is going to be introduced by Dory. So I just want to say welcome to Wednesday. Claude, so just so you know where the folks are at right now, they've been 2 weeks since the transition to the next classes. Is that right? And so right now they're knee deep in game theory. My understanding is on Friday, you guys are going to be talking with Richard about Zillow and why they went belly up on all their houses that they purchased. It's a great example of, we're arguing about, is it the winner's curse or is it adverse selection? They're both the same thing. You guys get to talk about that. And then in Professor Delacroix's class, Claire's class, they just did instrumental variables, right? And so we're going to be talking about instrumental variables. So that's where folks are at, Claude, just so you know. And Dory, I'm going to turn it over to you for the introduction.
Thank you so much, Randy. Good afternoon, Dr. Setodji. I would like to thank you for taking time out of your busy schedule to talk to us today, and I'm very sure that you're going to learn a lot from you. And so I'll begin by introducing Dr. Setodji. Dr. Setodji is a senior statistician at Rand Corporation. He's also a co-faculty at Rand Pardee Graduate School and a co-director at Rand Center for Causal Inference. He's also an adjunct professor at Haynes College, School of Public Policy and Management at Carnegie Mellon University. For his education, he has a PhD in statistics and a Master of Science in Statistics at the University of Minnesota and University of Benin in Togo. Dr. Setodji, welcome.
Thanks.
So I would like to begin by asking you, what got you into statistics?
Can you repeat the question again? I couldn't pick that up well. Can you repeat it again?
Sure. What got you into statistics?
Oh, what got me interested in statistics?
Yes.
I guess I would say it was by random choice that I got interested in statistics. I started as when I was growing up, my first degree was in mathematics. So I had a master's in mathematics in West Africa. I grew up in Togo, West Africa. So I have a master's in mathematics. Now, to be frank, I had a master's in mathematics because that's the one thing that interests me there. There was no Department of Statistics where I was growing up. And I wanted to do something applied, but I couldn't find anything that applied. So I went into mathematics because I actually enjoyed the math aspect of things. But when I moved to the United States, one of my friends actually asked me if I wanted to go back to school and do statistics. So that's the random part of the decision. And I actually thought about my courses and I realized, oh yeah, this actually falls in line with some of the things that I wanted to do in terms of doing something more apply with some of the mathematics theory that I learned. And so that's in that sense that I decided, oh yeah, it would actually be really good to actually do statistics, which I saw as an application of some of the theoretical aspect of things that I was doing in mathematics. So that's how I end up in statistics on the first place. So it's kind of a random thing where it was not like, since I was 4 years old, I was thinking about doing statistics, but I actually end up enjoying it. I really, really end up enjoying it. That's why I end up staying doing it. Because when I got in Minnesota the first year, I could have said, no, I want to do something else. But my first courses started making me realize, oh, this is something that I can actually apply and do something more specific with it. That's why I end up going in that direction.
Oh, wow, that's awesome. And so you've done a lot of research. From the ones you sent me, approximately 112. So from the research findings, how have they impacted policy formulation at the state level, local level, and the national level?
That's a good question. That's a really good question in terms of how much the research that I do impacts people or impact decision makers. So the type of research that I do, it comes from two different sides. Some of them are research that I initiate or group of, there's a group of us that work together that we initiate those ideas. But the second piece is research that a specific decision maker want to have an answer to. and they come to us and ask us if we can actually see if we can answer some of those questions. And so the ones where where somebody approaches us to actually solve a specific problem, those have like direct impact, right? Because that's what the decision maker is trying to do. So they will come to us and say, oh, we want to do this, or we want to evaluate this. Can you do it for us? And so those have the direct impact that you want it to have. Now, I'll try to give you an example in a minute, but the second piece, the second part where we generate the ideas, sometimes the whole thing will end up where a decision maker will look at it and will say, oh, I was not thinking about this particular issue, but it will be really interesting for me to actually use what you have done here to actually make the decision. So those are the two pieces of impact that is what I do tend to have. So I'm going to give you the example and one example in each category. So for decision maker initiated research, for example, right now I'm doing an evaluation for the state of New York. And so they have this demonstration. They call it the Health and Recovery Plan, HARP. That's what we call this plan that they have in New York State. And it's a demonstration that is designed to improve the access and the quality of care of beneficiaries or healthcare beneficiary in the states, especially the ones with behavioral health need. So people have behavioral health need. Usually people with behavioral health needs are the ones that actually end up not going to see their providers at all. And so they developed this program to see if they can actually help people actually gain access. So you want them to improve the access, but also get better quality. And on top of that, as we all want to do, you want to reduce costs because you don't want to improve access where the costs keep going up so you can do anything about it. And so that one, I mean, I'm going to say they come to us, but that's not usually how it works. Usually the state of New York will put up a request for proposal for anybody to say, we have these demonstration. We want somebody to evaluate it for us. We want somebody external to evaluate it for us. So we apply for it. And so it's a team of, I think there's about 5 or 6 of us. We have a physician in the group. We have a psychologist in the group. We have a statistician. I'm the statistician. We have an economist in the group. So we have different group of people in the team. And then we all apply for this. And then they gave us the opportunity to actually do the evaluation. So in this particular case, all the result that we got, actually, I was working on it today. It's actually going to go on their websites. And then they're going to start using that because what they are thinking about is, okay, we have something, we have a demonstration. Is that working? If that's not working, how can we change it? Because it's not like something that's going to end tomorrow. They want to continue this demonstration. So if it's not working, what changes can we make? So based on the result we will be giving them, I think in the next month or so, we actually be giving them our final report. They will actually start making decisions. And those decisions are going to go from, should we continue doing what we're doing? Are we increasing too much cost? Do we actually see people actually getting the access and the quality of the care that we wanted them to have? So all those things come into play. And so those things have direct impact because somebody asked us to do that research for them. And they use that to actually make their inferences. The second one that I talked about where we start generating the idea, one example that I can give you is a project that I'm working on, I ran on smoking. And this is ideas where we know a lot of people who smoke, they want to stop smoking. And so we also have a lot of smoking policies, smoking reduction policy across the US in different states at different local levels and stuff like that. And so one of the one that I'm working on is on flavored tobacco products, for example, where the idea here is to wonder if the tobacco product that are advertised at your 7-Eleven or at your Walgreens, if they were now flavored, will that actually impact people in terms of, I want to use it? Because when somebody hear this tobacco product is chocolate flavor or this flavor, then it entices people to actually get it. So for that particular project, one of those projects, what we decided to do is to actually test those hypotheses. So we started the notion of the idea of this research where we say, we want to test the hypothesis and to see if you have a lab, an advertisement on flavored tobacco versus an advertisement where you are not advertising any flavored tobacco at all, will that have an impact on people that actually come to a store to look, and then that's from there where they're actually buying their stuff. And so we start with that idea, we conduct our study, but at the end of the day, we publish that as a result. But if you can think about it, the FDA is the one that cares more about that, because the FDA is the one that's going to make the decision in terms of policies for for tobacco research. And so the FDA is the one that's going to pick that up and say, oh, we see this research that was done. This is what the impact of flavored tobacco is on kids. Usually smoking now tends to be focused more toward young adults, because the younger you are, the more likely you are to uptake smoking. And so the FDA is the one that's going to pick that up, and it's going to say, okay, because of the result that we got from this particular study, we got to decide to ban flavored tobacco or not ban flavored tobacco. So that's how some of those things go. Now, a lot of them, I don't even know it has that impact, right? For the one that we generate, I will put a paper out there and a publication out there, and then a decision maker in North Dakota might actually pick it up and say, oh, we're gonna make our decision based on this. They never tell me that, but at least it's still there. Sometimes when you start looking at, or at least when you start looking up your citation of your paper, that's when you start realizing, oh, my paper was cited here, where they use that to actually influence the decision making and stuff like that. So it kind of varies depending on what's happening, but those are the two cases that I can talk about. Make sense?
Oh, that's awesome. So I would like to know, how do you feel being part of a group that provides evidence-based policy for policy decision-making?
So you say, how do I feel about being part of a group like that? Is that what the question is?
Yeah, how do you feel, like, your findings?
It's great, right? Because that's, at least for me, again, because from what the question you asked earlier, and I told you, my ideas were about to start to work on practical problem. For me, this is like the best case scenario, right? Where I can see the things that I do will impact something in decision making. So it's a great feeling. It's actually a really, really good feeling. And I think that's what makes us keep going, doing what we're doing. Now, let me be clear about one thing, right? Because a lot of these research, some of them will fail miserably, because it's called research for a reason. Because you start research doesn't mean you're gonna actually get to, what the decision maker is hoping that you will get to. So it comes those times where you gotta actually sit in front of the decision maker and tell them, look, this demonstration is not working. You gotta cut your losses and move on. Or the one that we start ourselves, where we say, oh, we wanna see what is the impact of, when I was talking about flavored tobacco versus non-flavored, or we're talking about e-cigarettes nowadays. Some of those come out being empty, and you gotta, it's just one of those things, you gotta live with it. That is part of research. So the good thing about it is, every time I think about one of my research being a failure, I can think about asking the next question, right? The next question is gonna be, why did they fail? And then what is the next step, or what is the next research we should be thinking about? And so even though some of them will come into failure and it feels really bad, I don't feel bad at the end of the day, because I know I can take the lesson learned from those to actually move to the next level, which is, what is my next research thing I should be thinking about? Make sense?
Yes. Also, there's some international organizations like the World Bank, the World Health Organization, UNICEF. They're also involved in research. I would like to know, do you collaborate with those organizations to carry out research, for example, regarding healthcare or education?
So I don't know about collaborating. Usually a lot of those international organizations, they will request our assistance in doing specific things. It's the same way I gave the example of the state of New York that actually put out a request for proposal to actually do something specific. You will see a lot of the organization like the World Bank does this all the time, where they put out a request for proposal, where they are thinking, because even though they have researchers in-house, it's not like they don't have all kind of researchers, right? So only few organizations have all the researchers you can to actually do so many different things. And so if something is not in their wheelhouse, they will actually reach out or put out a request for proposal and say, oh, we want you guys to actually do this. So I've actually written a proposal. Gosh, that was probably 10 years ago or something like that, where the World Bank was trying to understand women going to school in Burkina Faso. That's in West Africa, a country in West Africa. And so they were trying to understand what is the frequency or what is the impact or what are the different things that are happening in that country when it comes to women being able to go to school. Now, in that setting, they put up a request report. I wrote a proposal. It was naturally not funded. Another organization got it funded. So those are things sometimes that I will do with them. Once in a while, you actually get an international organization that will say, we want to collaborate with you. But collaboration also still feels with me like I'm doing a lot of some of the work, they are doing some of their work, or we are talking together about something. So where I come in with my expertise, they come with their expertise and say, we want to do A, B, C, and then you bring in your expertise. And I feel like that's actually that's the same thing for almost all the projects I work on. Like the one in New York, the New York State, they have their own researchers that they are thinking about the same problem, but they know they have some limitation. Also, to have an independent evaluation, they will reach out to somebody like us. And so we actually end up talking to a lot of their statisticians in terms of some of the issues with the data, because they have a lot of data issue with that. So those are the kind of stuff I tend to do. So collaboration, yeah, but not a lot. If it's international organization, it's usually they'll put up a request and say, we want somebody to do this. And I will say, sure, I can do this. And then, if they fund us to do it, then we end up spending our time doing it.
Well, thank you so much. I would like to open the floor to the students to ask you some questions. And I'll begin with Shivanji.
Hello, thank you so much for taking the time to speak with us.
Sure.
So Dory had mentioned that you work on multiple projects at any given time. And I was wondering, what is the workflow like when managing so many projects between getting things done with any projects and finding new proposals?
Yeah, that's actually a really, really good question. And for somebody who wants to do what I'm doing, or if some of you guys want to end up doing research, it's actually something that you should actually understand a little bit of the process. And as you said, as Dory told you, I probably, every given year, I probably work on between 5 to 10 different projects. That's the amount of project that I work on. Now, I'm a little bit extreme. Most people I run are more toward the 5 and 4 or 5. I think in one year I was doing like 18 or 20 different projects, but that was just crazy because I have so many things going on. But the workflow, at least for me, the way the workflow works is I have 5 different projects right now. Or if I have 5, I don't remember how many I have right now going on. But if I have many projects going on, my day starts with, my day is set up into meetings, right? So this morning I already have like 3 different meetings this morning. And one meeting will be on a specific project. The next meeting will be on a different project. And the next meeting will be on a totally different project. And so when we go into those meetings, it's a discussion about, how do we design this? How do we design this? How do we do this analysis? I'll bring my expertise, right? The physician that's sitting across from me is going to bring their expertise. The economist is going to bring their expertise. The social scientist is going to bring their expertise. And then at the end of the day, I might go back in my corner, right? I might go back in my office, and then I might actually spend some time implementing some of those discussions we made, some of those things that we decided to do. Like, I didn't do this today, but yesterday we were talking about, in one of my smoking studies, we were talking about randomization because we have an experiment that we have going on. And the question is, how do we randomize people and stuff like that? And so I created a randomization scheme and I sent it to the research assistant. That's actually going to implement that. So I will do that. But this is the piece you actually have to know if you want to do a lot of at least something similar to what I'm doing. Then, so I'll do that for 1 hour or 2 hours. And the next hour, I have to shift my brain. Where now I'm thinking about, first I was thinking about smoking. Now I'm going to start thinking about COVID and education and education system. That's my next project. And so for that next project, I'll have to think about, okay, what are we doing in there? What is happening there? So you kind of have to be, you should be able to focus your attention on one thing and shift 90 degrees if you have to think about something else. Now, the reality is I'm a statistician, right? A lot of the things that I do are pretty similar. like one of the things I spend a lot of my time thinking about is like causal inference and all that kind of stuff, right? So when I get into all my project, that's the first thing that's in my brain. That's the first thing I want to try to get at, right? Causal aspect piece of things. Now, the small details that come in terms of, for this particular project, this is how we're going to solve, this is probably how we're going to solve this. It makes it different to where you have to compartmentalize, but it's not that big of a deal for me. So even though I have 10 different projects that I'm working on, I can actually make them work together where I can switch my brain from this one and move to the next one, move to one. And to be frank with you guys, actually, that's one of the things I like about my job. I'm not gonna lie, because we joke about this all the time, that as a statistician, if you ask me to do the same job every day, where I'm gonna be doing a t-test all the time, I will go crazy, because I can't keep doing t-test over after t-test. I wanna think about something novel. I wanna think about something interesting. So in that realm, if I think about all those projects I'm working on, it's kind of like having multiple different jobs during the day on what I'm doing. And that's something I like doing. Now, some people might not like doing that. Some people might like thinking, I want to work on only one thing. For this whole week, I want to think about only one thing. Usually that doesn't happen on my way. Now, once in a while it will happen because I have a client that says, oh, we need this thing done in a week. I mean, we need this thing finished in a week. And so I have to put all my time into that, spending all my time doing that. But usually it's one of those things where I focus on this, and then the next hour I'm focusing on something, or the next hour, the next day I'm focusing on something else, and then I'm focusing on something on the next time. It sounds hard, but it's actually not. It's actually a lot of fun. That's why I like doing what I do. Does that answer your question?
Yes, it does. Thank you. I had another question. So what were your expectations from going in from school and doing all this work into like your first jobs? Like there's like certain sets of expectations you had about like what would be in the workplace. Like how close or far was your expectations to reality? And is there anything that we would be surprised about?
Sure, that's actually a pretty good question. So expectations, I don't actually, nowadays, I don't even know what my expectations were, or I don't even know if I had an expectation when I started doing what I'm doing, right? Because I have to admit, when I was in grad school, I was thinking more, I'm gonna end up at university as a professor somewhere at a university, because that's how I was trained. At least I was trained in a very theoretical department. And so the thinking was going to be, I'm going to end up at somewhere in a university, teaching in a department, and then doing a lot of theoretical research, right? So the first surprising part was I end up at a place where I'm not doing a lot of theoretical research. I'm doing some, but not a lot. I think somebody was talking about I had like 134 pages, probably about 10 or 20 of those are theory papers. All the other pieces are applied papers, right? So that's the first surprise in terms of expectation. So I didn't have any expectation when I was going in, or at least I didn't know what my expectations were. But when I got there and when I started doing what I'm doing, I started realizing, oh, I like doing this. That's why I'm doing it. And so that's the first thing in terms of expectation, or what is that close to what I'm doing now, or is that far from what I'm doing? Maybe I didn't have an expectation. So even if it's close or far, that's the same thing. Now, there are actually more practical things that are going to happen in terms of expectation, even the day that I start working, or every year. I feel like I probably set myself up with some expectation. What are my goals for this year, right? What are the things that I want to do? What are the papers that I want to work on? What are the methods that I want to work on? The most surprising thing for me sometimes is that, like, the most interesting things that I end up working on, I think that I did not plan at all, working on them at all, right? Because a lot of the things that I end up working on are things where I'm walking down the hallway, and then one of my coworkers said, oh, I have this particular problem. Can you help me think about it? And I'll say, yeah, let's go sit down and think about it. And then we think about that problem, and I was like, oh, this is very interesting. Can I know more about it? And then we get into that. And so, like I was telling you guys about smoking study, a lot of the stuff that I've probably been doing research on smoking for probably 10 to 15 years now. And it literally happened by random chance, because the first time when I moved to the Pittsburgh office and one of my coworker in the hall would say, "Oh, we are thinking about this pretty cool idea, and we want a statistician to help us think about it. Do you want to come and help us think about it?" I was like, "Sure." And then I joined, and I sat in the meeting, and I was like, "Man, this is very, very interesting." And so I can tell you a little bit about that, right? Because it was this issue of what we call big data, but when we were doing this thing, we call it ecological momentary data collection, where the idea is you want to collect data on people as things are happening to them. And in this smoking study, they were thinking about, look, we were thinking about advertisements, cigarette ads online and all those places, how that impact people. Usually how research is done is people pull back, when you ask people to fill up survey, you ask them, over the last year, how many cigarette ad have you seen online or on TV and all that kind of stuff, right? That's how it's done. But at least when I was having this first discussion, the psychologist that I was talking about said, but the problem is the recall. If you ask me, how many cigarette ads have you seen over the last year? I'm probably gonna give you a wrong answer because I don't know, I don't count them. Even if you ask me over the last week, I won't be able to tell you. But they thought about this idea where we're gonna have participants that will be carrying their cell phones in their hands. And so every time you see an ad, you answer the question. And so all of a sudden, I have a light bulb that started blinking in my head. I was like, gosh, this is very interesting, because now I can actually end up getting a lot of information on one person. Because if you are carrying your phone and every day, at least we make sure that the people that the participant will answer questions on their phone 3 times a day. And on top of that, they can answer their own question if you've seen an ad somewhere. So we have a lot of it, and we have them carry these phones for like 3 weeks. So now I have people with a lot of information on them. And so then the questions start becoming, what can I do with that? And so for me, I did not expect that at all. This one was not one of my expectations at all. But then when I got into that, all of a sudden, then I started wondering, okay, can I analyze that data? As a statistician, what are the methods that I can think about? And as a public policy researcher, what are the impact of this particular data set we are collecting? And so then you can see things start ballooning very quickly when you start having more ideas. And so in that sense, there's a lot of things that I did not think about when I was going to this. And the example that I just gave you is something that I was not expecting at all. But then just running into one of my coworkers in the hallway, it turned out to be like a 15-year project that I've been doing this for a long time. So at least for me, that's the moral of this whole thing. The expectation is great, but it's gonna change, or at least for me, it changed. I always say my career is usually a random walk. Where today it might go in this direction, tomorrow it might go, and there's no way I can predict what's gonna happen because it's always random. And I love it because, again, this is one of these things I love about it. I don't have to think about, oh, I'm doing exactly this or I'm doing only this all the time. Even though I'm at the same place, it feels like I'm doing different work, different jobs. I'm doing different things all the time. So hopefully that helps.
Yes, thank you. I appreciate, I think one thing you've emphasized is the flexibility in going with the flow and just seeing what opportunities you get and just going forward. Thank you.
No, I agree, because I think that flexibility is going to actually take you a long way. Because one of the things that I have to say is we are all trained. When you are trained at a university, you are actually trained to actually be very flexible, because you take all these courses, you take all these things. At some point, you're like, I don't know what I'm doing with these things. But when you get into this situation, you realize, oh, maybe I learned this thing. I can be flexible enough to learn to see how I can use it here. Even if it's not my expertise, I want to be flexible enough to learn more expertise, to learn something. And so that's one of the things you have to keep in mind. So.
UC has a question too.
Hi, Dr. Setodji. Can you hear me?
Yeah, go for it.
Yeah, I'm UC. I have a question. Like, you talk a lot about expectation and randomness in your life, but as we are at this moment now, we are thinking about what our future will be. So for people who want to do research in the future, do you have any advice for them to be more prepared for future like research career?
Sure, good question. So I think as I was just telling you guys, being flexible is one of the best thing I can actually tell anybody that want to do research, but because your research career or your career, it might not even just be your career is going to be a random walk, where the next thing you don't know where it's going to be coming from. But in terms of being more prepared, because I think that's what you just asked, I think for me, one of the things that I try to tell students is to try to grab as much expertise as you can. I know it's a catch-22. When I'm saying grab as much expertise, the question you guys will ask me, where do I get that expertise, right? Who do I sit next to? But I think you guys talking to people like me, or you guys working as an intern somewhere, is gonna give you a lot, because now, don't get me wrong. When I was done with my PhD and when I started working at RAND, I actually did not have any public policy experience at all. I did not do any public policy work at all before I started working at RAND. And I was fine. But I wish I have done some, at least at the beginning, because when you come in an environment where you're thinking about research, at least in the RAND setting, you're going to come with your expertise, but you will be working with other people with other expertise. So when I was talking earlier, I said, I have physicians that I work with. I have psychologists that I work with. I have economists that I work with. I have health service researchers that I work with. I have education researchers that I work with, right? And a lot of the time, we all talk different languages. When I say we all talk different languages, like the simplest thing that I can think about is like, so when we talking about modeling and stuff like that, some people will say, oh, this is a covariate. No, this is a predictor variable. This is, people will call it so many different things that it's actually good to actually be able to understand what all those concepts are, right? So you can learn that on the job. But when I was in grad school, I've always said it, I wish I spent a lot of time just like in the social science department, just learning, taking classes where I can learn some of those things. Because now I have to communicate with a lot of social scientists. I have to be able to explain to them what I do. So, because I have to take statistical terms and explain it to them. And then they will tell me what they want. I have to be able to understand what they want me to do, what they want to do. And so it would be good to actually have that place where you can actually have that communication. So be able to get that experience from other areas. It doesn't have to be your area of expertise. You don't have to necessarily have all the expertise as an economist. The expertise that you're gonna gain from like an education researcher might actually help you. So being able to actually get some of those things actually can be useful. And if you have the opportunity, not everybody has that opportunity, but if you do have that opportunity, I would say you should definitely try it or just sit in. I have research assistants that work at RAND with me all the time, and that's one of the things I tell them. Just sitting around the table. So you have about 5 different PhDs sitting around the table having a discussion, and you being like a research assistant with a bachelor or master's, just sitting in that room and just listening to that conversation, listening to how they think about research, and listening to how they go about research is one of those things that's like priceless, because whatever you learn in school, when you get on the field in terms of research, you have to start being creative. And that creativity, it usually doesn't come that fast for everybody. But if you have that exposure, it'll be good. So that's one of the things I would say, to be prepared, try to get yourself exposed to some of those things. Whether it is through an internship, if you don't have an internship, through having discussion with other people that are doing that, that are doing specific work, or people like me, you can just pick up the phone and call somebody like me and say, oh, look, I have this particular thing I'm thinking about. What do you think? How would you proceed with this if that was you? Can actually be really helpful. And so that when you get out there, you might be able to implement some of that. So sorry, I don't know if I answered your question because I feel like I went over all the place, but hopefully that gets you some of the answers that will be helpful. Does that make sense?
Yeah, it's helpful. It's very helpful. Thank you.
The next question is from Olumayor.
All right, yeah, thank you, Dr. Setodji. In the process of answering other questions, you've actually answered my question. What I would love to ask about was actually like motivated you into going into research and the impacts your research findings have made so far, and but you've answered all of that. Thank you.
Sure. Now, does that actually bring you to other questions though? Because I mean, you don't have to stick with your questions, right? You can actually just flip and just think, oh, whatever this guy just said, make me think about this. You can go for it. Just ask the question. So does that make you think about other things that you probably want to know from the things that I already said?
Yeah, like you've talked about flexibility and the fact that doing research makes you feel like you are doing a whole lot of different jobs at the same time. And that's kind of exciting to me because I've discovered over time you get some jobs get monotonous. You do some things the same way, the same thing over and over again. Maybe a few years down the line, you just feel like it's no more exciting. But it shows me that research is very exciting, and that's what I'm actually thinking about.
Yeah, no, I agree. I agree that, like, at least for me, doing the variety actually is very exciting because it makes me feel makes me feel like I'm actually doing different jobs all the time. Or it makes me think harder about some of the problems because it gets boring very quickly, as I said it earlier. If I'm doing a t-test every morning, I come in, I push a computer. Actually, I don't even have to do it, right? Because you have all the computer software that can do your t-test for you. So I just push a computer key and it gives me a t-test. It's not fulfilling. I need to do something where I'm thinking about a problem. I'm thinking about how can I actually solve this particular problem, practical problem. So yes, those are the things that will be good if you can start thinking about those if you want to go in this direction. So.
I think I would like to follow up on the Mayo's question. So,
Sure.
I'm Cookie Mensah. I would like to know, have you ever encountered any conflict in your work with other stakeholders where you've done research, your policy recommendation was not accepted, but you know it's a workable and a viable one? So what was that situation? Thank you.
Oh yeah, actually I had that this morning. So I had that this morning. So in terms of conflict, so the thing with decision makers is a lot of them come with their agendas, right? I mean, in some sense, that's understandable. So like with the example that I'm giving you of the demonstration in New York City, right? In New York, where they have a demonstration to help patients get a better care, get better access. Their goal is to be able to help those patients to get to those points. Now, when me as a statistician, I come in and I say, yeah, it doesn't look like your demonstration work, then that's a failure for them. Even though for me as a researcher, it's not a big failure, right? It's always, a research that doesn't work is always the starting point for the next research, as far as I'm concerned. But for the decision makers, they probably spend a lot of money to actually do some of that kind of, to implement some of that demonstration. And now I'm gonna come along and I'm gonna say, yeah, it doesn't work, just throw it out. I think that's the hard part for them. And so I get it. And you get into that conflict all the time. And the one thing that actually make that conflict happen is the fact that usually when we actually do these research, the research, we have to put assumption in a lot of things that we're doing, right? Because the world is not as perfect as what we learn in grad school. In grad school, for example, at least when I was in grad school, we were taught if you fit a linear regression, you want your R square to be like at least 0.8, 0.9, right? Before you're confident, oh yeah, this is actually all your covariate are explaining what is in your outcome. Guess what? In the real world, if you get an R square of 0.1, you gotta be happy about it. Now, the problem with that is then you go to a decision maker and you say, this program is not working. By the way, my models, I have a lot of uncertainty on what my model can accomplish here. If I fit a linear regression, I only have the R square is 0.1. And so I'm gonna tell you your program is not working, but keep in mind that there's a lot of assumptions that I put in here, and that might explain some of these things. And decision makers don't like that, and I get it, because they spend a lot of money to do this. Now you're gonna say it's inconclusive. That's kind of what I'm trying to say. I come back at them and say, it's not working, but I think it's inconclusive. Or I say it's working, but I think this is still inconclusive. And they're like, no, I don't want that. I want you to give me something specific, because I want to be able to go and tell people out there, this particular drug, if you take it, is going to work or it's not going to work. I don't want out there to tell people, yeah, I think it will work, but I don't know for sure how much. They don't like that. And so that's going to happen all the time. But that's part of what we do as researchers. The only thing I think you should do when you come in those situations is that you got to be able to tell your audience, your readers, whether it's the reader or the decision maker or whoever is in front of you that you're talking to, that you come, all your analysis come with assumptions, to keep those assumptions in mind. Now, I'm telling you this, and I know this, but every time you tell all decision makers, these are the assumptions, nobody pays attention to that. Because you get a story on the New York Times that says, this study has done this. It never tells you about what are the assumptions that come with it and what are limitations. But that's the reality of what is out there. And so those conflicts are going to come. I think you as a researcher has got to make sure you put down your foot in terms of, these are the limitations of what I've done. And this is how far I can go when it comes to making inference. I remember once I was at CMS, the Center for Medicare and Medicaid, when I was giving the presentation on this program that they were using. And I came up and I said, look, I have inconclusive result. I cannot say that this program is actually helping reduce cost. And they kept pushing because they said, no, don't give me the statistical jargon. Just tell me, is this program working or not? And I said, I can't tell you that. So I had to stand my ground and say, look, at the most, what I can tell you is in this particular situation, it's working. In this particular situation, it's not working. But I cannot just throw out a word out there and say, oh, it's working or it's not working. Because the reality is, and a lot of the things that we do, like if you think about any medication that we take, it might work for some people, it might not work for some people. So that instability or that variability is always going to be out there, even though people don't like it. So you got to just make that clear when you're actually making your inference. Does that make sense?
Yes, thank you.
Any more follow-up questions? Okay, our next question is from Rachel.
Hi, Dr. Setodji. My name is Rachel. We met at the advisory board meeting. It's really nice to see you again. Your answer actually leads perfectly into my next question. I was going to ask you about the uncertainty that's involved in causal inference work. We just started our first causal inference class. And you were just speaking just now about how sometimes you might have to reflect that uncertainty to clients, and sometimes they're not happy about that. Now we know that you're an expert researcher and things like that, and so I'm not questioning your research designs, but do you ever get clients that do that? Like, do you ever get clients who how do you convince them that your research design has been set up properly? Because so much of it is just up to whether you buy into the logic behind the research design. You can't really mathematically say, this number proves that, I did this right. So how do you deal with that? And I have a couple follow-up questions on that, but I'll let you answer that first.
Yeah, so how do I deal with the problem of design, right? And that's actually a great question. And that's a hard question, because even among us, if I think about you guys as researchers, we're gonna have a lot of disagreement when it comes to like even the design or the assumptions that I'm making. Now, let alone talk about me and the decision makers, whereby most of them don't have a clue. When I say I'm talking about quartiles or quantiles, they're like, I don't know, just give me one number that tells me what I want to do. So I think for me, when I go into some of those, when I go into the research, I try to be very mindful of a lot of the methods that are out there that I can use to make inference, right? So you were talking about causal inference. So I think one of the things guys were looking at is instrumental variable, right?
Yes.
Instrumental variable is one of the great things that we can use to actually draw causal inference. The other one that we tend to use is a lot of us use is like the difference in difference methods, which is basically you collect information before your intervention and information after your intervention, and then you have a treatment and control group that allows you to do a lot of things. The other one is the one that I spend a lot of my time thinking about is the idea of counterfactuals, where instead of saying, does this, when I want to say, does this program or a program works for me, it would be good to put me in a situation where I did not get a program, as well as in me in a situation when I got a program. That's not possible, but how can I do to make some of those things work, right? So that's only 3, but that's a lot of them out there. So when I go into the research, I usually think about what are the possibilities. Now, the easy one is usually when I have all the wheels in the world to actually design my experiment, where I can do randomization, because we all know that's the perfect case scenario, right? I randomly through people, some people in the program and some people without a program. So that's the perfect case scenario. And usually in those cases, nobody can actually say, oh yeah, this is not causal because it's random. I randomly put the people in here and treatment and control and see what happens. Now, the places where these problems that you were talking about in terms of design and how people will agree or disagree with it come when we talk about observational data. Like the one I'm doing in New York City. You cannot randomize people and say, you have to get into this program and you don't have to get into this program. You can't do that. You cannot randomize people into, you have to be Hispanic and you have to be Black. You can't do that. That doesn't work. Or you can, even like in terms of, when we think about COVID today, right? You cannot randomize people and say, you gotta get COVID and you don't get COVID. You can't do that. So that's when those issues happen. And when those things happen, then for me, the first thing I start thinking about I usually put all those methods in front of me, right? And tell myself, which ones do I have enough information to be able to use? So if I'm thinking about instrumental variable, can I think about a good instrument in this setting to be able to do my analysis? If I can think about it, then I'll put that on the shelf. That's one of the methods. Can I do a difference in difference method? Can I do a counterfactual? Can I do all these methods? I mean, I can think about all of them. And then on top of that, then I'm start asking myself, all the assumptions that come with those, which one is more plausible in this case, right? If one is more plausible, then I'm probably going to be going toward the other. The other one that I tend to do now is start to combine some of those methods. So the one that I was doing this morning was combining propensity score and difference in difference. What I'm saying, okay, I know difference is one method. It has a bunch of assumptions with it. I can combine that with propensity score when I'm doing matching, and that comes with assumptions. So the more of those are combined, the better the assumption. But does that solve all my problem? No. I'm always going to have this issue because, as I said, even with you guys, if I think about you guys as researchers, you and I are going to have differences. So that's not going to go away. So at the end of the day, you have all these design issues. You just have to lay it out on the table when you actually write your report. These are the assumptions that I make. These are the assumptions with my design. And that's why every single time we write a paper, you will see at the end, you have a limitation section. Limitation is blah, 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 blah. Now, do not let anybody push you too hard and say, because of all those limitations, then your research it should not be taken for what it is. Because the reality is, we have, as a human beings, we have to make decisions. We have to make policy decisions today. Even with those assumptions, even if they are not perfect, the decision we make is better than just having a decision maker sitting in the office, flipping a coin, head, tail. I'm going to implement this or I'm not going to implement it. So, because for me, those are the two options we are talking about. Do you want to just have somebody sit in the office, flip a coin and make the decision? Or do I want to give them some data that says, this is the trend, even if it's not causal, this is the trend that I'm seeing. That may help you make the next decision that can actually help us make the causal decision better. So that's kind of what I try to think about when I'm actually going there. So I know I talk about a lot of stuff, but I try to put all the methods in front of me. which one is gonna work best for this particular problem that I'm dealing with. And after I choose that, if I can combine them, I'll combine them. But I always want to make sure I put the limitations in there, put the assumptions in there so the reader can actually know what I'm doing. And as I said earlier, New York Times will probably forget your assumptions, but still put it in there because New York Times is not your problem. The problem is going to be the next person, not the researcher, that's going to read your work. They read the New York Times articles and they say, oh yeah, this is pretty cool. I'm going to read this person's work. And if that person cannot replicate your work, then you are in trouble. Replication is one of the problems that we have for researchers, right? Because it's always possible that I can sit in my office and make up numbers. So, I mean, I would say, oh yeah, this treatment, there's a treatment effect here. But if there's not, usually nobody can tell because I cannot give my data to other people to analyze easily. And so in order for people to be able to replicate your work, you want to put down all the assumptions because again, the next researcher is going to try to do almost the same thing you've done to see if they can replicate it. The more replication we have of the phenomena, the more likely it is that it's actually causal. So that's one of the things we have to keep in mind.
Thank you. I have a related question, but this time it has to do with the same thing, but I'm asking about your internal team dynamics.
Mm-hmm.
I'm wondering, like, you know, are you ever sitting around with your team thinking about a research design and there's just an honest disagreement about what way to proceed? I'm wondering, you know, well, you're the director of the Causal Inference Center, so I'm wondering, how do you resolve those disagreements? Yeah.
Yeah, no, that's a good question. And I usually I don't know. I mean, you can think about it either way, right? You can think about it as a disagreement, or the way I usually try to approach those problems are, look, this is a different way to look at the problem, right? And let's have a discussion about it. This is where I'm coming from. Because again, so I do this with a lot of, I'm not an economist. I have a lot of my coworkers that are economists, where we have these arguments all the time. And this is one of those classic arguments between economists and a statistician. The economist is trained to think a lot about instrumental variable, and because that actually it has a lot of good things that come with it. As a statistician, I'm trained to think about causal inference in the counterfactual framework, where I'm trying to make groups match and stuff like that, right? And my method has a huge limitation. The things that makes people choose to be in one group versus another group, if I don't measure them, I cannot do a causal inference. But the economist, if your instrument, you cannot prove that your instrument is a good instrument, you cannot use it either. But this, in the instrumental setting, you cannot test some of the assumptions. Same way in the counterfactually, you cannot test the assumption. So I usually try to have those discussions in terms of, okay, let's lay it on the table. This is how we were all trained. Now we all understand each other's in terms of what are the limitations of our different methods, right? Now, as an economist, tell me what are your fears in terms of the things that was not measured in my methods that you think will make my method fail. And for me, as a statistician, I would tell you, these are the reasons why I think maybe this is a bad instrument that we should not use. And if we can all come down to an agreement, sure. If we don't come down to an agreement, we've done a lot of these things where we say, let's actually do both methods and see what happens. And then we start like hypothesizing. Because if the results are similar, then we're all happy, right? Because your method is as good as my method, so we're happy. But if the results are different, that's when we start wondering, why is this possible? And so we start having to think about, but again, for me, that's a research problem, because not all these things come with assumptions that we cannot test. As long as we cannot test those, at least I can actually look at the data and see what is the data telling me. Are they the same? If they are the same, we can go into discussion about what is what. And I've written reports where I actually put both of them in there. With this assumption, this is what you get. With this assumption, this is what you get. By the way, decision makers don't like that at all, because what they want to tell me yes or no if this is working. Don't tell me this assumption makes it work. This assumption don't make it work. They don't care. They want to know what is this working or not. So sometimes I've done that as well. So again, it's one of those things where I think about it as more like a scholastic mental exercise, where we try to use those differences to try to understand each other's and learn more from each other. So
thank you so much.
Any follow-up question? Okay, our next question is from Kristen.
Yeah, hi, thanks for your time. You've touched on this quite a bit, so I have a little bit more of a nuanced question to ask. Originally, I was just wondering how your work varies from that of researchers or policy experts. But we've gathered that, you know, you're touching a lot more on the methodical approach to the research designs and less so on its application. And correct me if that's wrong, but I'm curious, are you involved in the whole life cycle of a lot of these research projects, or are you pretty involved with the data collection, the research methods, and then you kind of let the rest of the team do their thing? And same for your coworkers, is that a similar?
Yeah, no, that's a really good question. I actually don't consider myself only the design person anymore.
Okay.
So I think, I mean, so we work, usually when you think about a project, we usually have a group of 4, 5, 6 people that are working on the, thinking about a problem. I think about all of us are policy experts for that particular project. Because even though I bring my expertise, the funny thing is I have to learn from the other person's expertise. Like, I know a lot about smoking now, because I spent a lot of my time actually working with people that actually are psychologists that were trained to think about smoking as cessation problems. So I think about myself as just as part of the policy researcher group. Now, even in that group, everybody has their expertise. And as somebody was just asking me a minute ago, when a final decision comes where we cannot all agree, maybe that person will have that decision if that's their expertise. But I think we all are experts in that setting where we all bring in our expertise. So this, I actually will hate it if I have to come in as a researcher where you ask me, just design the sample and go away. I will not do it because it's boring for me. I want to be able to see from the beginning to end. A research project for me starts from, let's conceptualize the idea of what we want to do. Let's set up even the research question that we want to do, all the way down to let's collect the data. Yeah, I'm gonna be the one directing that. All the way down, let's analyze the data. Let's make inference and let's see what that means in the whole setting. And so it's always one of those things where I'm part of the whole process. It's not just I'm just this piece and then I'm disappearing. Does that make sense?
Yeah, definitely. Can I ask a quick follow-up?
Sure, go for it.
The writing process for reports as well. It could vary project to project, but.
Can you ask again? Sorry, I missed that. I missed you say for writing pro.
Contribute to the writing of reports for clients and.
Yes. Yes, I'm also part of the writing process. And so when we write a report, usually, so this is what happens sometimes. I will write a piece, somebody else will write a piece, and then we all have to read it together. So if it reads like only one person write this whole thing, right? That's the hard part for me, because I'll write my piece and then we put it all together and like, yeah, it looks like 2 people wrote this thing. So that's the only thing you have to think about. Actually, we have a bunch of people around, we call them communication analysts. We actually use their help. Their PhDs are like in English, writing and all that kind of stuff. So I'll write my piece, somebody else write their piece, we put it all together and they will read through the whole thing, see if it reads well. But yes, we are all part of it. Usually what happens is as a statistician, they will ask me to write like the method section, for example, and the results section. But at the end of the day, I'm gonna read through the whole thing. Because remember, when I go sit in front of the decision makers and they're gonna ask questions, they're not gonna ask me a question as, you did only this part, right? They're gonna ask me a question about everything. So I need to understand all the pieces that go into that report. So.
Thank you.
Hi, my name is Smart Johnson. I'm not sure if you can see me over in the corner. Thank you for giving me your time. My question is, at what stage in research do you reach out to other experts in different fields? Is it just in the design phase of the research or is it throughout? And when do you kind of have to step in as the lead in research when it comes to other expert opinions?
When do I reach out to other people? All the time? It's all the phases of the project. Not only sometimes I reach out to other people, because remember, where I work at RAND, we probably have about 1,500 PhD researchers. So I can actually reach out to any of them. It's so many different things. So usually what will happen is there might be 3 of us that might be thinking about a problem. And we're like, we need to reach out to an expert. We'll reach out to them. And if they are willing, they can actually join the team. So a lot of cases, good times, we reach out to people and they actually become part of our team. And that's how I became part of big multiple team that way. But the reaching out, if you need an expert, is all across the board. Sometimes we start a project, we are all the way down to like finishing writing the analysis. And then we were like, so this happened last time where I was working on the project, we didn't have an economist on the project. And then we have a cost problem. So we have a cost that we have to analyze. And then the client was asking, how exactly are you going to analyze this cost? Because this is the cost of healthcare. And the client was wondering, what is the best way to do this? Should we be looking at the cost per member per month? Or should we be looking at the total cost that like patients has across the years? And I was like, I don't know, I'm not an economist. So we had to reach out to an economist to actually guide us through that. And so you do that all the time. You can do it from the beginning or all the way to at the end. Now, when do I actually take over as like the lead? It depends. It depends what is needed. If that's my skill set, sure, I will grab the lead. And again, also that happens anywhere through the process where you say, okay, for this piece, yeah, we have to do this. And I'm expert in this. I know more about this. Let's do it this way. And then I'm going to actually grab that and run with it. But again, this is a collaboration world when it comes to the research world. You don't come in as, oh, I want to do this for me. It's just actually, we're actually trying to do this, think about this process together. So sometimes there's compromises, right? Because I might say, I'm the lead, I know really well this. Somebody else will say, I know really well this. I might have to compromise and say, okay, you go ahead and take it. So sometimes you have to compromise.
Thank you.
Oh, the last question. So what is the biggest benefit of staying with an organization for a longer time as opposed to jumping from one job to another?
Okay. So I think the benefit of staying I don't know if there's necessarily a benefit for staying with one organization. I was gonna say it's because I'm just old, so I don't want to change. I'm just I don't want to change, so I'm just stuck with what I'm doing. But the reality is this, because I was actually thinking about this a couple of months ago. I was looking at the data that was showing that younger people actually tend to switch job more often nowadays. So, and I started looking into this because one of my friends is much younger than me. And I think he's had, in the last 5 years, I think he has like 3 jobs. Where, I mean, he's really happy with it. Where for me, I'm like, yeah, I don't know. I kind of don't want to be just jumping left and right now. But the reality is, if I think about the job that I do, it's not like I'm doing exactly the same thing all the time. So at the end of the day, I feel like I'm in the same boat, like somebody's moving job all the time, because every year, every month, or sometimes over weeks, I'm doing something different. It's not like I'm doing the same thing all the time, where I'm working on one project and I'm doing that one project all my life. As I said earlier, I will not do a t-test all my life. I will go crazy if I have to do a t-test. If that's what that means to be actually work on the same place all the time, yeah, I don't want any part of it. Don't count me out. But for what I do, because it's always you have to think about novel things. You have to keep thinking out of the box. It always feels like I'm doing new jobs all the time. And so it never feels like I'm doing something, the same thing, or I'm doing the same job. But as I said, I'm just gonna blame it on age. I'm just getting old, so I don't want to change. And I'm just like the grumpy old man that is stuck doing the same thing. So.
Oh, anyone?
We should probably, we've gone over, we should probably thank you. Yeah.
Thank you so much for your time.
All right. Thanks, guys. All right, it was nice talking to you all, okay?
Thanks, Claude.
All right, bye all.
Hey, guys, so just a quick, we'll